Thank you very much,
And then now
Honorable
to take
Chief
your
Minister.
productivity to the next.
One group picture. Thank you, CM sir, and thank you all the panelists. Now I have an announcement. We are breaking for lunch because we are running short of time. Organizers felt that we will break for lunch. However, best we thought of giving food for thought. If you are hungry, you may not be able to focus on the discussions. So we'll break for lunch and we will exactly assemble here in 2:10. Thank you very much. CM sir also will adjourn for the lunch and
help us make things simple. Now when things become simple, I call them cell phone of anything. You want to create simple solution? Cell phone or something. I go back in 1985 and I'm looking at a meeting with the Minister of Telecom and the government. They said if they wanted to give every citizen, and then there were 45 crore Indians, which means we were about, say, 45 crores, 10 crore families. If you want to give phone to every house, it will be 2,100 and probably will not be there. Technology changed. In 1995, November, some date, cell phone comes to India. In 5 years, nearly everyone has access to phone. Every family who could think of it had access to phone. What happened? Technology was made simple to the point that everyone could have it. And the government did nothing about it. Government did not have to do it. So one of the programs today in the world where everyone has access to a cell phone, they don't have water. They don't have potable water. They don't have drinking water, but they have cell phone. So what happened? Because taking water to the person or to a hamlet, to a house is not easy. But cell phone became so simple, it was possible. So the question is, how do I make technology so simple that governance becomes simpler? So just a test was, if I can remember my Aadhaar number or Social Security number, which every American does, because they are the originators of Social Security system. If you look at it from the same point of view, and I'm trying to urge you to see the notion of simplicity in governance. Now think of it, all the programs, when I look at our own evolution, we are a 75-year-old society. In 75 years, we have gone from $50, the richest economy in Asia, in 1947, richest economy in Asia. We have gone from there to become an economy of $2,400 per capita, while Korea has gone to $50,000 and China $20,000. We began the same way. In 1947, we began the same way. India was about $52, China was 47, Korea about 48, and today, India is at $2,400, Korea at 50,000, China at 20,000. That's our journey. What happened? I'll try to share with you, it basically is a matter of governance. What happened? We were the pioneers of planning. 1950, 50s and 60s. Korea began 62, 10 years later. But they began differently. We began the same journey, but by the time it becomes 1981, Korea has gone to $1,000, we were still at 130, 40, 50. So what was happening? So point is, if you look at the planning itself, the way we plan becomes very critical to the process. If you plan in a very, a different kind of arch, you will find different kind of results. Today, we haven't achieved the goals of first plan. That's a very interesting story. While Korea had learned from us, they came to learn planning from India. They began planning 10 years after India, and they became so successful that they began having a company of $40 billion in 1990, when India's biggest company was hardly $2 billion in revenue. So how did that happen? So when it comes to governance, I think simplicity is very important. It should be, look at, is it good for the last person? Who is the last person? When I look at our data for India, by the time you reach 2 lakh rupees per capita income, which is the average income, you're already touching 2%. 98% earn less than that. So I would say, how do you look at the GDP? GDP should be seen, not GDP per capita. One of my friends said, maybe let's call it median. My point will be, you're trying to raise zero poverty will happen when the last person has no poverty. So look at the last 10%. What is the GDP per capita in the last 10%, for instance? These are the questions which we have to go on asking. Can technology help us in that? Now let's look at how we look at it. In the US, in 50 years, there are a dozen entrepreneurs who created companies which are bigger than India. In 50 years, a dozen entrepreneurs create companies which are bigger than Indian market value. How does it happen? A person who began a journey in America 27 years back is the richest man in the world. He came to America from South Africa via Canada. Today he's the richest man in the world. How did that happen? So in other words, it's possible today, if we imagine, to create an ecosystem where a single person can create economy as big as India's. Microsoft, Apple, Google, we all know these names. But it never occurs to us that these companies were founded by single individuals. And they created that level of market value, which is possible by India too. Then think of this way. California is a 40 billion people economy. Andhra is 55 billion people economy. California is 4 trillion economy. Andhra is $200 billion economy. The gap is about 40 times. US-India gap is about 35 times. But remember another thing. There are 50 million people of Indian origin outside of India. They earn as much as India does. 50 million Indians earn about $3.5 trillion outside of India, which 1,500 million Indians do it here. They have similar, what is changing is not, they are not changed, their ecosystem changes. What we are doing is, we are not changing the ecosystem. If you change the ecosystem, it changes productivity, it changes us. How do you change the ecosystem? Change the possibility of you becoming what you want to become. That is missing for 90% people. When we create a society where every child has the potential or possibility to become what the child wants to become, not what parents want them to become, child wants to become, that society becomes a very different society. So in governance, we haven't looked at these questions. We have looked at questions which are essentially either very high-end, remove poverty. Remove poverty doesn't remove poverty. Hasn't done in 75 years. Literacy by 1960, nothing happened. But literacy you are talking about, literacy means nothing. If I know ABCD, am I very capable? No. Similarly, when it comes to education, what do? It's not A, B, C, D, it's not one thing or the other. What is education? I'll give an example. My son was 7 years old and he said something interesting. He didn't want to go to school. I said, what happened? Well, I don't want to go to school today. I don't feel good. I said, okay. So why won't you go to school? He says, who wants to go to school? I said, how about learning? He said, who learns at school? I said, what? What do you do at school? I said, we get educated at school. I said, what is that? Education is what teacher wants me to learn. Education is what you want me to learn. What's learning? What I want to learn. That difference made all the difference of education and learning. We never thought of it. So in the US system, the effort was, what does the child want to learn? In our system, effort was, what do we want them to learn? You know, we had a good friend called Kapil Sibal. He became Minister of Education. Farid Zakaria, and we were sitting in New York. He was talking about education. He said, what's the future for India? Kapil was very open about it. He said, I want skilling in India. My challenge was this. Skilling is not going to create a great society. Skilling will create people who can do here and now job. But learning will create something which will create society. So we had the potential to be great. So should we become great, or should we become what we are here and now person, here and now society? And that's a big challenge. So I went to about several states, spoke to chief ministers. Many accepted my ideas. But things will come down to, but my education minister doesn't accept what you say. I said, well, that's a big problem. But easy running is not a central subject. You take your call. But they will say, I'll say one laptop per child, and they will buy a laptop. Laptop was just one means. As a CIO of Roche at one time, I learned one thing. When I said technology in India, they said PC, desktop. When I said technology in America, they said, well, that's only 6%, 7% of my cost. Ecosystem. So technology is not a piece, it's a complete ecosystem. And we become productive in ecosystem. So my submission is this. Simplicity in understanding something that the last person can understand takes us much farther than making it complex. A cell phone number that you can remember, if that becomes Aadhaar, that tells us the way we think about society. That helps us, create a great society. Same thing happens to all Indians who go out. Without doing anything great, they become part of an ecosystem, they contribute a great deal more. So we have to think of ecosystem. And I'm very happy to hear very powerful words: global, sustainable, transformation, and ecosystem. So ecosystem is what's critical, because otherwise it's like throwing seeds which will never grow. So you create ecosystem for that, and you have a farming. So my point will be this. I flew from Boston. I think I'm a little jet lagged. And this is a little too hard on me at this point in time. But the point is, ecosystem was the most interesting word I heard here, that we're talking about that. It was not being talked about 10 years ago. It was just one project, one task, something. So when you create ecosystem which has sustainability built into it, that is something is going to help us become a great nation, which can help Andhra have $100,000 per capita income 25 years. When I look at Korea did this, and Korea and our population of Andhra and Korea are about the same. Korea's economy already, I think, more than $1 trillion, $50,000 per capita. I think their population is about 50 million, so about $2.5 trillion economy. We can be too. We can be in less than 25 years. They achieved that in about 25 years. If you see the rate of growth, it's 3 times per decade. Ours was 50% per decade, except for the decade of 2001 to 10, when we grew up 3 times, we have been doing 50% every decade. So we can do 3 times a decade. And I think in 20 years, Andhra can plan to be $100,000 per capita income economy if you really choose that way. That's a possibility. But beginning has to be made like China did. What did China do, what we didn't do? 71, when Nixon and Kissinger come to China, they started a new journey. In China, per capita income in 1971 was the same as India, as $191. And 2001, which is about, 1991, we were about 393 or thereabouts. But 92, China gets past India, and since then, it's been kind of galloping. Today, it's about $20,000. We are at 2450 or thereabouts. So China did something interesting. It planned for 20 years for human development, people development, and that did it. Korea did the same thing differently. Korea says every single Korean, more than 21, is a graduate. No other country can claim that. That's what takes $50,000. So I would say that great societies just take some basic things about society very, very seriously, which is respecting their citizens and making sure that they can find their dreams, they can live it, they can create it. That's what it's all about. In America, pursuit of happiness was very important. So they allowed everyone to achieve what they want to achieve. They create a system for that. And that's what made America great. It went past Europe. Since 1945, 90% Nobel Prizes go to people in America. They may be American, they may be foreigners in America, but Europe's basically lost out, America began gaining. The reason was the same. Reason was they focused on people and they said, we will help everyone achieve their dream. My submission will be that the greatest programs we have had, they have not been government programs. Cell phone was a program not run by government. Technology and support. Don't do it. Doing has never, I have analyzed about 100 programs of government, not one of them achieved goals. Our people are best. Our bureaucrats are amazing. Our leaders are amazing. I can't get a single vote, and they can get billions of votes. I was not part of civil services, and I've seen them, how brilliant they are. But when it comes to achieving things, something is missing. What is that? Because there is something missing, and my submission is, what's missing is, we become busy with our today. We don't think of tomorrow. We don't think of 20 years hence. So good thing is, we are thinking 2047. That's a great thing. So a lot of great things are already happening here. 2047, global sustainability, transformation, ecosystem. These are all great things. But unless you bring it down to my privilege to be here, and thank you, Mr. Tucker, thank you, Sri Ram, but my submission will be very simple. Let's make it simple. Let's look at the foundation. Let's look at the last segment of the people. Let's appreciate the fact that we are the same people. When we go in a system, we become more productive. Question is, if you can create the same ecosystem, we can be better productive. We have the potential to be as good as we want to be. There's no question about that. We are as good as we want to be. Let's help all of us to become as good as we can be. And with that, I'd like to thank you very much. Thank you indeed.
Thank you, Satish ji, for your insights into how global best practices in GovTech can be templated and adopted to Andhra Pradesh, how the institutional and policy framework is required to scale GovTech solutions in state of Andhra Pradesh. Now it is my pleasure to invite, there is a change in the program. We have moved the health tech session to in the place of GovTech. So it is my pleasure to invite Honorable Health Minister Sri Satyakumar Yadav ji, Government of Andhra Pradesh, and also Sri M.T. Krishna Babu, Special Chief Secretary to Government of Health, Medical and Family Welfare. Sir, request you to join the dais. I request Krishna Babu Karu to deliver his. Sorry, I missed it. I request Honorable Minister to speak, and then Krishna Babu Garu will deliver his keynote address. Subsequent to that, we will invite the panel for the panel discussion.
Respected Chief Minister of Andhra Pradesh, గౌరవనీయులు చంద్రబాబు నాయుడు గారు, the directors of Global Forum for Sustainable Transformation, distinguished guests, officials of Andhra Pradesh, and participants andariki namaskaram. I am indeed extremely delighted to be part of this important conclave that throws some valuable light on possibilities of taking Andhra Pradesh healthcare to new heights. I sincerely compliment the team of Global Forum for Sustainable Transformation for taking this initiative, and also confident that the deliberations and outcomes of this important deep tech conclave will provide a roadmap and way forward for taking the healthcare delivery of Andhra Pradesh to new horizons. As we have already seen a few innovations in the exhibitions and also in the presentations, which can bring in a transformative change in the lives of the people, and more particularly in the health sector. I must thank the organizers for keeping this podium very low, so that I am not only audible and also visible. It is universally acknowledged that health is wealth. For the health of the people has direct impact on the economic growth of any individual, family, or the state, or the country as a whole. The historical analysis of 13 developed countries has established that 1% increase in lifetime expectancy has resulted in 6% addition to the GDP and 5% addition to the per capita GDP. Which highlights the healthcare of the people, impact of the health of the people and the economic growth of any country. In this background, now we are aiming to become, when we celebrate centenary celebrations of our independence in 2047, we are aiming to become Vikasit Bharat under the leadership of Honorable Prime Minister, whose extraordinary leadership qualities, out-of-box ideas, have transformed the otherwise bankrupt economy of the country into one of the top economies of the world today. And on the other side, we have a leader, a visionary leader, who in the early 90s itself envisioned, understood the importance of IT and the kind of positive change that can bring in into the lives of the millions of youth, as also aiming to make Andhra Pradesh, Swarna Andhra Pradesh by 2047. The vision of the state and the country is defined by the two great leaders who have courage to dream, commitment for delivery, and compassion for the poor. Under their leadership, I am pretty confident that India will become a Vikasit Bharat by being one of top two largest economies of the world, and also Andhra Pradesh, a Swarna Andhra Pradesh. But when I say so, the health to attain this, to achieve this by 2047, health assumes significance, because accessible, affordable healthcare will create healthy people. Healthy people in turn will add to the economic growth or wealth creation. So, in this context, we have many challenges in Andhra Pradesh, like even in the country, as we are still a developing nation, where many gaps, demographical, many diverse challenges. During these challenges, it is important to leverage technology to find solution to face these challenges and bring in a transformative change in the health sector. I'm pretty confident because the achievements of the health ministry and what the state and health ministry more particularly is affecting for this conclave will be presented by our Special Chief Secretary Krishna Babu Garu. But I want to say one thing. We have a huge data captured by our healthcare professionals, right from the ANM, ASHA workers to ANMs to CHOs to healthcare professionals in the teaching hospitals, collected from 10,000 plus wellness centers at the village level and 1,700 plus primary health centers at rural and urban areas, and more than 250, close to 250 community health centers, area hospitals, district hospitals and teaching hospitals. But how do we integrate this data with the technology and bring in a betterment in the lives of the people and healthcare sector in particular? That's where deep tech solutions come into the picture. These solutions must provide predictive analytics, because my Honorable CM keeps talking about all the time about the new technologies, blockchain, data analytics, artificial intelligence solutions. These solutions should bring predictive analytics and therefore allowing us to take precautionary preventive measures and save the lives, and more particularly reduce the out-of-pocket expenditure of a common man or a patient, and also burden on the state exchequer or the nation's exchequer. So I urge upon the youth of the Andhra Pradesh, because Andhra Pradesh is known for intellect. There are lakhs of people because of Chandrababu Naidu Garu have migrated to America, and they are proving their mettle. So I urge upon all of them to focus more on this deep tech solutions and help the Andhra Pradesh health sector. And I know, you all know, the leader like Chandrababu Naidu Garu being at the helm of affairs, the investors or innovators will get every possible support in the state. I take this opportunity to urge upon, appeal Honorable CM, sir, form a committee particularly on that, and you have been bringing many policies in every sector, and also appeal you, sir, to bring in a policy for deep tech innovations in Andhra Pradesh, so that more and more youth comes forward and they will be instrumental in building the Andhra Pradesh, Swarna Andhra Pradesh by 2047. So I take this opportunity to thank the organizers for giving me this opportunity of meeting of all, and more particularly to learn many things. I am not a doctor, I am a health minister. I have been a health minister for the past 6 months. I have always been a political student or an engineering student. I never knew anything about the medicine. Nothing, and not even a terminology. But still, Honorable Prime Minister, Honorable Chief Minister of Andhra Pradesh have given me this opportunity to know many things and be an instrument in bringing a change in the lives of the people of Andhra Pradesh. Thank you all.
Thank you, Honorable Minister. Now I have the pleasure of inviting Sri Krishna Babu Garu to deliver his keynote address.
Yeah, a presentation. Good afternoon, Honorable Chief Minister of Andhra Pradesh, Nara Chandrababu Naidu Garu, GFST Takkar Saab, Honorable Ministers, MLAs, MLCs, and all the other distinguished guests. So, I just wanted to just present about what this Andhra Pradesh Public Health 2. Why we are talking about 2 is the way in which Honorable Chief Minister wants us to think, act, using the digital technology, using artificial intelligence, machine learning, and deep tech to take preventive action rather than concentrating on curative thing. Curative is always important, but coming back to preventive gives much better result. Our Swarnandhra tagline is towards wealthy, healthy, happy Andhra Pradesh. So by 2047, that is the kind of society Honorable Chief Minister wants to do. So this is, we are going towards that. Just I will present what exactly, where we stand today, what are the challenges being faced, and what we wanted to, all the invitees, GFST, I thank especially Takkar Saab and the entire team, to make available this much talent pool available to health department to think, to interact, and also to collaborate, developing a system wherein we can make this goal, happy and healthy Andhra Pradesh, a reality. So, demographically, Honorable Chief Minister always talks about demographic management. That slide is gone. Just can you go back? So the main challenge is fertility rate is presently 1.54 and it is going to drop to 1.37 by 2047. So this has a serious implication about the dependency ratio may be the same, but the child, that is 0 to 14 years population, there will be almost 7% decrease, and 60 plus years population is around almost means from 14% to 23%, 9% increase. So this will be posing a real challenge in the economic development because the working age population is going to reduce. This has its own implications. That is why how to ensure that the fertility rate increases and also the dependency ratio comes down by creating a workable solution to the 60 plus age group population. We have overall, if you see Andhra Pradesh, we are having better indicators about access of the people to the health facility. Whether it is the village health centers, public, PHCs, primary health centers, or area hospitals, beds for 1,000 population, except the CHC, coverage of community health centers, we are above the national norms, IPHS norms, and human resources also, Andhra Pradesh is fortunate to have very positive human resources. As per the WHO norms, whatever is required, we are much above that. Whether it is the doctors, including specialists, is 1.5 per 1,000 population, nurses around 3.8 per 1,000 population compared to 3, and 50 overall total population for physicians, nurses, and midwives for 10,000 population, almost 50.9 compared to WHO standards of 44.5. This is a very positive way where we have good human talent pool, especially in the health sector. We just jotted down the Swarnandhra goals and SDG goals. SDG goals we have to achieve by 2030. Honorable Chief Minister always directs us to plan such that we reach the goals much before it. We are doing reasonably well, almost 4 indicators out of 8. We are already close to achieving the SDG goals, and balance 4. It is under 5 wasted, then adolescent girls, anemia, tuberculosis incident rate, and also life expectancy. These are slightly difficult to achieve as on today, but next we have 5 years time definitely we'll try our best to see that they are achieved. But Swarnandhra goal, aligned with Viksit Bharat, is a very tough call. So all have to change the way we plan everything and then ensure that we reach there much early. The percentage of out-of-pocket expenditure, now it is as per NFHS 5 survey, it is almost 63.6%. The toughest goal is this, bringing it to less than 5% by ensuring that health insurance for all is made effectively implemented. See, similarly, we have almost 80% of the population covers under NTR Vaidya Seva. So we have to make it 100% and also we have to streamline. The government has already made a promise in the manifesto, the health insurance for all. Geriatric care facilities, presently we have in district hospitals, subdivisional hospitals and CHCs. Now it is the goal is to ensure that all the healthcare facilities up to the village health clinics have the geriatric facilities. NABH, NAQS, basically quality indicators. As of now, 7% of the institutions are given certification. So our target is at least next 2 years, we should at least reach 80%. We are working on that. Key initiatives, what we are doing is, we have to make a health profile of the entire population. So ABHA ID is one of the key indicator where if now as on today around 4.19 crore individuals we are able to do the ABHA ID and which reflects to 80% of the population. Then when we do the survey, now NCD 3 survey is going on, we are doing universal health survey wherein all the NCDs are being recorded, including the cancer care. So cancer, the preliminary screening for breast, cervical and oral cancer. Then all these suspected cases found out by the health level worker, village level health workers, CHO, ANM and ASHA workers, they will be confirmed by the medical officer. After confirming, they will be put on the treatment. Then continuity of care is ensured by almost line listing of the data is available to ensure that all are covered. Almost now the continuum of care is around 80%. Just we have to make it almost 100%. And also ABHA ID creation, now it is around 80%. We have to ensure that goes to 100% in this screening. Then maternal child health care is another very important area. Almost 69 lakh children, especially 6 months to 6 years and also school going children, we are having the health screening going on now. Then whoever is registered in RCH portal, pregnant women, they are tracking of them, seeing high risk pregnancies and tracking and seeing that they get proper care such that the maternal mortality, infant mortality is reduced to substantially minimum. So we are doing anemia monitoring almost monthly basis for the pregnant women and quarterly basis for adolescent girls. And also follow-up is being done both at PHC and CHC level and also referral services by iron sucrose injections and blood transfusion, and if that is not responding, then other referral mechanism. We have a strong EHR, now we are doing almost all the hospitals from PHC to tertiary hospitals. We are putting integrated electronic health records. So this is a centralized repository of the patient information, and this will be having continuity of tracking of the individual from primary health, from the preventive care aspect, from the primary health side till tertiary care. And we have integrated the primary health to tertiary care such that the people who are identified with certain problem, whether that referral is happening properly or not. So almost now we can proudly say we are the almost leaders in India to have almost 5.5 crore health records which are linked with EHR, electronic health record. and 19,700 health facilities are in the EHR. We have created Abhas. Then health around 58,900 professionals are also done. Then unified data platform. So all the departments, ultimately the result will be when all the departmental database talks to each other, and we plan according to that and means to see whether the outcomes are coming or not. So we have developed a system wherein health, women and child welfare, school education, Panchayati Raj, municipal administration, all the databases are integrated with taking this API, and nutrition and anemia status of pregnant and adolescent girls, as well as health monitoring, high risk pregnancy of the women, and also other side sanitation, vector control measures, water quality testing. All these are integrated such that the information with one department is available for all other departments to see and act. So, and also monitoring can be done at the senior level. Another thing what we are doing is existing whatever items are there, for monitoring of that we are using technology, biomedical equipment, almost 1.33 lakh equipments are there, which are put on the system, and we know the exact status of how many are working, how many complaints are raised, how many are getting resolved, etc. Teleradiology services, similarly CKD and dialysis patient treatment, telemedicine consultation. Almost Andhra Pradesh is having almost 21% of India's total teleconsultations as of now. Almost average calls is 65,000 per day. So this is how we are able to make available the specialist services from the hub, from the specialist to the lowermost health system, that is village health clinics. Then with facial recognition, almost we have started using 106,000 employees of health department. Each employee, they have to register in the face recognition system, and they have to make attendance 3 times. Morning 9 o'clock, 2 o'clock and 4 o'clock. So by that, at least compared to earlier time where only 60 to 65% attendance used to be there, almost when we started deducting the leaves etc. based on FRS attendance, now almost it is more than 92-93%, and sometimes it is reaching 98% if including leaves etc. Sanitation, security, pest control also, Honorable Chief Minister directed that the artificial intelligence, machine learning should be used to real-time monitor what is happening, what is the quality, rather than just depending on the report or feedback from the superintendent. So that is what is being done. What are the key challenges? Now most of the data is in silos. So naturally main integration, data fragmentation, so integration has to be there. So that we are trying. This is where we wanted to understand what best can be done in the shortest possible time to have visibility. Similarly, lack of outcome focused dashboards. So we have data for each of the items, but only thing is overall when we just review, we are lacking the kind of dashboards which will give real-time database. Similarly, data governance and also limited capacity of the employees to use the data and also build up concrete quality data. So then what is that we just wanted to have? That is, we want to develop a digital twin. Each of the person should have a digital image of him with the government, such that at least each person from the starting birth to death, he can be tracked and analysis can be done. So that is with advanced diagnostics. Then, of course, data privacy, as many of the speakers have told, that is the biggest challenge. So because this data should be available for understanding the geographical prevalence and also disease pattern and identifying the root causes for the disease.
One is, do you have a question? Do you have advice for Andhra Pradesh? Do you have a suggestion to make? And I would request you to be very brilliant. What I mean by that is be brief. no more than 10 to 20 seconds, because we would like to, and I'm sure CM Garu would like to hear from all of you who have a point to make, right? There are going to be 4 people, students. Thank you, students, for helping us move around. Can you put your mic up so people can see you? There are 4 students who are helping us. Please give them a round of applause to the students. They will take your points. So the way we will do this is that, as I said, if you have a question, if you have an advice or a suggestion, please make that clear to us. Sure. So the way we are going to do this is that mics don't work in the back. For practical purposes, people who would like to make a suggestion or a question, we would like you to line up in the middle. And I'm going to first call on certain people to come to start the discussions first. Mr. Paneer Selvam, Chief Executive, Meiti Startup. Sir, we couldn't hear you in the panel, but we would like your views. If you can come forward, please. And can a mic be organized for Mr. Paneer Selvam, please? Mr. Ramprasad, thank you. In your back, sir. Yes, please.
Very good afternoon, and thank you, sir, for this opportunity. I'm the Chief Executive Officer of the Meiti Startup Hub from the Department of Electronics and IT, Government of India. We are an organization, the deep custodians of deep tech startups in the country, and we are very privileged to be part of this conversation. We would have loved to have more time, but 3 things that I would like to share as part of how we can make Andhra Pradesh. One of the things that we see in the startup ecosystem is essentially a lot of our startups are solving problems for the urban India, and they really don't know, or they are not really aware of the problem statements from the rural part of the. So one of the suggestions that I could suggest is have a problem statement repository by the government, organized by each ministry, centralized, where entrepreneurs, innovators and problem solvers can access these problem statements at a centralized place and pick up problems of their choice and start resolving them. I think that's something which is very, very important and critical. And the second aspect we have is a suggestion we have is we always look at there are only 2 customer segments for the startups. First is government, second is corporates. And government is doing their role, and corporates are, a lot of corporates are setting up their corporate accelerators, corporate innovation program. There's a successful program in the central government called IDEX, which is the Defense Innovation Organization, has been running for last 5 to 6 years. And there's a model that almost all ministries can replicate, because they put out problem statements. They have their, one of the mentors from the departments mentoring the startups, hand-holding the entire journey and taking them to a logical conclusion almost for about 2 to 2.5 years' time. And it is a very strategic program that is in nature. And that's a model that most ministries can replicate. And from the Department of Electronics and Meiti, I assure you we will be very happy to partner, and we will share the know-how how we can take it forward from the Andhra Pradesh government side. And the third and the important element is a lot of government focus on funding, which is essentially important. But the truth is, there's more than money that we can give the startups, which is a procurement policy from the startup ecosystem from each of these departments. Because again, it's better to teach them how to fish rather than provide them with a fish. So it's kind of each department can set aside a certain percentage of procurement or from the policy in terms of that they can need to source this from the startup ecosystem. So these are the things that we really want to look at as suggestions from the startup side. From the Department of Electronics and IT, we are always there to support the government of Andhra Pradesh. And as a CEO of MSH, I am very glad to see how we can. Andhra Pradesh has a great opportunity to kind of work with us, and we have the opportunity to work with them to kind of drive the startup ecosystem in the state, sir. So it will be our pleasure to kind of again connect and maybe have a detailed discussion, sir. Thank you.
Thank you, Paneer Selvam. CM Garu, one of the things which came in yesterday's roundtable was that many times startups and medtech people come with a solution looking for a problem. Can the government be very clear, saying these are our problem statements? For example, sir, the Dwakara groups that you started off, can they now move online? Can there be a virtual self-help group? If we can put those problem statements clearly there, I think that makes it easier for the startup world to interact. Over to you, sir.
As rightly mentioned by him, as on today, we are having some problems, but we want to create excellent ecosystem. That's why we brought so many policies now. One is innovation hubs. In innovation hubs, we made 5 zones, 5 innovation hubs. For example, Zone 1, Uttarandhra, 3 districts, Srikakulam, Visakhapatnam, Vijayanagaram. Then Zone 2, that is East Godavari, West Godavari, Godavari districts. Zone 3, Guntur, Krishna districts. Zone 4, Prakasam, Nellore, Chittur. 5th zone is Anantapur, Kadapa, Kurnool. 5 zones we have created. We thought this is most viable. Then there will be central hub, that is Amaravati, to supervise, to guide them properly, everything. Name also we name Ratan Tata Innovation Hub. Here, as he rightly mentioned, one is a knowledge economy. And also our program is one family, one entrepreneur. This we wanted to make it reality. Then I have to create best organization for this total mentoring, venture capital, and how to identify everything in that regard. So we are also discussing with all of you. Ultimately, I told you morning also, as on today, some of the applications we are using. But so many applications we are not using as on today. Either knowledge economy or so many things. I can say how to encourage them continuously. We want to create 500 crores like that. Innovation hub, corpus fund, how to meet all these things. 5 zones, excellent industries who are all located in that zone. One top industry and also other industries present in their area will make it a body. Then academic institutions, these 5 zones, 5 areas we are having excellent academic institutions will integrate. Then we will bring venture capital. We need mentors. That is where other ecosystem also what all necessary will do it. Morning also I told very clearly knowledge economy, sky is the limit imagination. If you want to achieve all these things again, in knowledge economy data is available. As one example, just now my health secretary has given presentation. Ayushman Bharat, we are able to establish reasonably well. We can make it next level. That means 90%, 95%. Data is available. All this data, due to privacy, all these things will mask it, will put it before you. You come innovate ideas. Now Kuderu, one case study that is working. Some people have come with a pregnant lady, how to monitor. That is where our Dr. Rakesh has given a presentation morning. So like that, so many use cases are coming. What I wanted to request here, not only here, by seeing all these things, who are all innovators in the state, who are all innovators in the nation, even global innovators, come back with proper use cases. Even technology always, it should be more cost effective. Be clear. This is where I am telling. Even if you come with high cost, low productivity, no result, less results, then it may not be sustainable. That if you can come, morning also, our minister also has told very clearly, we will create an organization. How to hide single window. All your use cases, you can come to that organization. Respective departments, they will coordinate. Your use cases are useful. Straight away, they will use it. And at the same time, proof of concept. First, they will use it, pilot. Automatically, it is very good. Then we will replicate. Then we will give you results. Then proof of concept will establish. Then you can go to national level, international level for your product launching. This is where I am saying from the beginning. Today, not only one thing, what all we are thinking here, somebody already in advanced stage. So many brains are working globally. So early is the best way. Very soon I am hearing all these things from you. Very soon we are going to establish that type of ecosystem in Andhra Pradesh. Then trial and error will work continuously. Ultimate aim is, I wanted to make Andhra Pradesh as a hub for knowledge economy, number one. Number two, every family, one entrepreneur. That is our mission. We will work together. And also innovators, I am appealing all of you. Recently we had a drone conference. Nobody visualized the importance of drones. Excellent use cases have come. Even some of the use cases I am shocked to hear, they are from remote area. Imagination, even they didn't have proper educational background also, they are innovating. Even intermediate students. Even Srikakulam remote area, people have come. And also by always one, if you see, all innovations were done not universities, sometimes outside universities. Not best graduates, even illiterates, dropouts. Even Bill Gates also drop out. This is where things are happening. So we'll work together. This is the, I'm very happy, everything we will publicize. You need not go to anywhere. There will be clear portal, committee, use cases, they will talk to you, we will adopt straight away, and then we'll give you proof of concept. We'll do it. Thank you.
Thank you, sir. Sir, yesterday we had around 150 people in the room. Tucker sir and Kutumbarao Garu was also interacting. Two problems came up, sir. One is government's ability to transparently procure medtech or any other tech in a way that we get it at the right price. As you rightly said, technology should not be expensive. It should actually reduce cost. So we need a policy and a system which enables procurement by the government to happen smoothly. And one big challenge, sir, given the rate at which the technology is growing, sometimes our capacity to even understand the speed at which it is going may stop our ability to evaluate a technology. So any thoughts, sir, how government can build an ecosystem as you're envisioning, which involves both being ahead, but at the same time being transparent?
No, we'll do one thing. Even I can take associations or experts from outside,
Right.
and also government people. Ultimately, government is supreme. It is a sovereign power. You have to accept, but sometimes you are having reservations. Government means it won't work. It will create problems. There will be hurdles. That is where we are thinking why people are going to Silicon Valley and launching the projects. There is a proper environment. Even a morning I have seen some presentations. Same time South Korea or some other countries have started economic development. They have reached new heights. But India is moving lot of potential, hidden potential. We are unable to expose all these things. But ultimately anything government has to promote. That is where Hyderabad success story. In the initial stage, small problems will be there. We will create a best ecosystem to take forward. I am assuring you, without having any bottleneck, I want to promote entrepreneurs in a big way. For this, we are streamlining total administration, and also it will be responsive. And at the same time, I will involve associations and also experts from private sector also.
Sure.
We will work together.
Thank you.
Even always startup companies, out of 4 or 5, every startup may not be successful. We are seeing. But we should not discourage. Continuously, sometimes 1 or 2 failures also, we must be in a position to absorb and encourage further. That also we are keeping in our policy. We will work it out.
Thank you. Thank you so much, sir. Can we have a big round of applause for that, please? This is one of the most encouraging things, sir. Because without that ecosystem, the private sector also cannot interact, but government also can't get the best out of the industry. Sir, with your permission, I would like to call on Mr. Manish Gupta from SAP. Manish has come all the way and he's from one of the most leading companies. Manish, over to you, please.
So my latest and greatest qualification, sir, is I am a father to 2 daughters. One is 11 and one is 6 years old. Both of them go to Blue Blocks Montessori in Hyderabad for last 8 years. And we were having a conversation last week, and one of them, the elder one, says that she wants to train and she wants to help the rural children by staying in Hyderabad so that the rural children or the rural society can earn their pocket money. My elder daughter is very good in origami, which is the paper crafts, and that initiated the thought in mind how we can actually utilize everybody who knows something in this state or in this country, that each one skill one, right? I will skill somebody, everybody present in this room will skill somebody. That's one of the thoughts. I'll take this back to my daughter and say I was able to bring this point to you. The second point, sir, is while terrestrial, we are doing a lot of interesting things in the state, in the country. It's nice to have the eyes in the sky, right? There are a lot of private companies which are sending CubeSats to space, in the low Earth orbiting space. And some of these can be used by the state machinery, by GFST, to identify a lot of interesting use cases. One is disaster management, the other is land monitoring. So once you have eyes in the skies, 250 kilometers up, there is so much possibility to do so many interesting things. I know one of such startups who would be willing to explore some of these interesting use cases. I cannot comment on the commercial part of it, but at least something very interesting that can be brought up. Yeah. The third thing was, sir, since I come from a technology company called SAP, we work very closely with enterprises. And I think government should also be treated like an enterprise. You earn money, you spend money, and there's an entire machinery which works. And if all the systems that are deployed connect to each other in a recent way, then what stops Andhra Pradesh government to function like a Tata Motors or a Tata Projects Limited, where everybody has the right insights, he knows what to be done, and they're getting the best service out. In this case, the customer is a citizen, right? The second last point was, sir, is the last mile is a big challenge because the government can have as only about this many people, and we have a large population in the country as well as in the state. There is one interesting concept of resident welfare associations. Now, interestingly, they are all registered bodies, and all the members are elected members. The housing committees, everybody comes together and elects those members. can these RWAs become an extension or a quasi-government extension to the localities where they can help in the locality development, problem solving, etc. And fifth one is my question to you, sir, is why is governance needed? Governance should be working automatically. The day I am born to the day I die, everything should happen on its own. And if that happens, with your vision of speed of doing business can happen on its own. Thank you, sir.
Thank you, Manish.
Last point, I'm assuring you, it will happen very soon.
Thank you. I can see that
That
happening.
means we are starting now WhatsApp governance. Government always wanted to control. As a matter of fact, we want to facilitate. We are forgetting facilitator role, then we are entering to controller role. For example, as you rightly mentioned, only human beings born only once and also die once. For these two things, MRO is going to update continuously with his discretion. What is the fun? I don't understand. Once he was born, it is noted, automatically anybody will come, date of birth has to give automatically, wherever he is.
Yeah.
Nativity cannot be changed, caste cannot be changed,
Correct.
pass percentage of schools or certificates, college certificate marks cannot be changed.
I agree.
All these things you have to go to pillar to post every year. Very soon you are going to see, you need not go to anywhere. All these things you can download anywhere in the world at your convenience whenever you require. Not only this, more than 100 or gradually I am making everything seamless. You can take services, power bill you can pay automatically, electricity bill or something, everything. Even you want to go to any temple, you can reserve ticket. By the time you can go and have darshan and then come back. All services I wanted to provide in a big way. We have started. That is where morning I told you very clearly. One is Aadhaar. It is a very good advantage for India. Second is your telephone. Now, OTP, all these things are coming. Now every family, every member, wherever you go, airport also, no need to have your passport or your ticket, all these things. Directly you can enter and go. What more evidence you need? So I wanted to move in that direction. One is individual, Aadhaar, bring them as a family, who are all in the family, then GPS, then everything will be authenticated. I will know what are all the requirements for each citizen, each family. Either house, outside or some other else, everything will make it. Finally, we are planning in such a way, welfare for the deserving people will give, and also tax payments also, one should pay transparent way without having any evasion. We will bring revolution with the technology. As on today, we are using technology as standalone system. I want to bring technology integrated.
Absolutely.
Very soon we are going to bring it. That will help us in a big way.
Thank you, sir. And I promise you on behalf of the citizens of this country here that if the government is going to take 2 steps, we will take 20 from our side. Thank you.
No, only sometimes you are not moving that fast. The motivation also is a big problem for me. Visakhapatnam is the exception. Visakhapatnam always very good city and also very, very committed, very docile people and also honest and integrity is very high. I have seen so many cities.
This is my favorite city.
Visakhapatnam is different from other cities, but people are by and large very good. But only problem is continuously intellectuals, you are having a responsibility. Which is good, which is bad, you have to identify. Continuously you have to support good, then only things will happen. Sometimes you will vote for any party, after that you will think, this is our responsibility, you have to deliver, but you won't cooperate. I need continuous cooperation, then we can do wonders.
All the best.
We'll
for
work
that.
it out.
Thank you very much.
Thank you, sir. Thank you so much, sir. May I, in that light, there are over 3,000 schemes and programs for the poor. Some of them are central schemes, some of them are Andhra schemes. And when we mapped it out, one of the things which came out is, as you were saying, deserving people, if the scheme is there, they should receive it. But there is an application process, there is a documentation process. Can we move one step further, sir? We have the DigiLocker concept. Can the DigiLocker, if all the documents are available, right? And if the family is eligible for certain things and they don't have it, is it possible to automate it slowly over a period of
That
time?
is what we are working as on now.
Okay, sir.
As a family, what are all the schemes is eligible?
Right.
As a family, what is the economic status? What is the skill or potential of that family? In a family, 5 members, all are not equal. One family member is having more IQ or advantages or skills, everything. So I wanted to plan everything. Individual identity, family as a security. Both will integrate. Automatically we can synchronize all programs with that family is eligible, and then we will apply for them.
Wonderful.
All of a sudden we may not do it, but minimum programs we have to target all families.
Right. Thank you, sir.
There is pension, there is ration, there is health, all these things, everybody is eligible.
Eligible for, yes.
Some programs, those who are all, that is where I told you, zero poverty P4. There I will focus more on last mile. Then they will bring them. For others we may not bring, but at least we will uplift. Continuous process. That is where we are doing. As you rightly mentioned, all programs I want to synchronize. Still there is a problem of literacy. Common man in the village may not understand, but our secretariat in the last mile, they have to coordinate, we will coordinate.
Sure. Thank you, sir. Thank you. Can I see some hands up, questions? Okay. You will need to move forward and take the mic. And while we do that, do we have Rohit from the Piramal Foundation here? Rohit? Rohit, can you come forward, please? This is a subject which you are very familiar with. So we have from Piramal Foundation, Rohit, who's done some amazing work on digital governance. And Rohit, if you can talk quickly to CM Garu about your entire DigiLocker approach and how it can be done. Then we will, ma'am, you go ahead first, please.
Sir, I'm Lakshmi, speech language pathologist and audiologist.
Mike, Neera.
I'm Lakshmi, speech language pathologist and audiologist. Here I've been hearing from past 2-3 hours about technology and healthcare. But as a speech therapist, every day I'm seeing around 10 to 16 children who are having autism, mental retardation, misarticulation. They're not able to pronounce even a simple word properly. So all this is sometimes because of electronic gadgets mothers are giving right at the early age, and about very poor awareness about speech and hearing issues, about communication issues in the health sector. So what we thought was earlier, see, I have a Vishaka Speech and Hearing Center from past 20 years. Earlier we used to have an Institute of Speech and Hearing in Hyderabad. But after bifurcation of the state, whole of Andhra, we don't have a speech and hearing college itself. So hardly we have 100, we have an association called Andhra Pradesh Speech and Hearing Association. The whole of Andhra Pradesh Association, we have 20 to 30 speech and hearing professionals who cannot service or give awareness to all these people of our population. So we initiated permission from Andhra Pradesh to start a speech and hearing college. The problem here is we do not have faculty. So they keep asking for where is the faculty, how can you educate the bachelor's or diploma course students if they come for.
Sure.
So we would like to ask, in case if we can have virtual lectures from all over the world, even from Basel University, we have people coming here who are pioneers of this speech and hearing communication disorders. Until we have this virtual permission to implement in colleges like us, see, ours is a very small firm. Vishaka Speech and Hearing is hardly 20 years young. To get permission, we have to go to Rehabilitation of Council of India in Delhi.
Ma'am,
So they have particular steps to
you're
be
asked,
handled.
what is asked for you?
Yeah, so what we wanted to ask is their permission they will give only for the faculty. But in case if you can help us with a virtual permission to get lectures from online, then we can have multiple, by 1 year we can have 20 speech and hearing professionals developed in this state.
Right.
So every year we can develop so many speech and hearing professionals and help our future children who will not have any communication or speech and hearing problems.
Thank you.
Thank you, sir.
What about our Secretary
Krishnababu garu,
Krishna Babu? You will answer.
Sir, Elite Council actually, RCI mandates physical lectures, availability of physical lectures, sir. We will just check up, sir, and whether that kind of faculty is available or not. Otherwise,
Our suggestion is, we will have one college,
yes,
both virtual, physical, integration of lectures globally, and also continuously we will train our people. That is one. Second one, Government of India permissions. How to get it single window? Can we get it?
Yes.
Simple question.
RCA has to give NOC, sir. She has already applied. We will follow it up.
Not individual case. I am not bothered about, she brought a problem.
Yes.
How to make it effective implementation, free for all, but no children in Andhra Pradesh should suffer because of that, lack of infrastructure. How to do it, you tell us. You get
We
it
will
done?
work together, sir.
You
actually.
take suggestions and get it done.
Yes, I have taken number, sir, her number. So we will work together. Sir.
How many students are there in Andhra Pradesh? Everything. How many children?
Yes, sir.
Okay. You give the details, we'll get it done.
Thank you.
Okay.
Thank you. Sir, your point is that estimate the total number of children, how many people we need, and solve it at a system level. Done, sir. Sir, I would like to invite Rohit very briefly. I would request all speakers to be very brief. And Rohit, if you can share the Digital Bharat Collective work, and if you have any ask from CM, sir.
Sure. Thank you, sir. Sir, myself Rohit from Piramal Foundation, and we have an initiative called Digital Bharat Collaborative. Under that, we are committed to strengthen the health system in the states. We have piloted our programs in Bihar and UP in collaboration with the state government, wherein the command and control center at the state level is formed, which was inaugurated by the CMs of the respective states, whereby we could able to really monitor and govern the programs, health program from the state, as well as from the districts with the different district magistrates. We could able to establish the review mechanism over there, and in the block we could able to help to the officials in creating the differential planning for improving the indicators of the health in the block. And finally, with the frontline workers, we've been helping them to really build their capabilities in managing her work. So this work has been done extensively from last 4 years with the states, where we started building the blocks from creating the digital architecture in the states, as well as governance mechanism in the state. I'm hoping that with this learning, if we can able to also come to Andhra Pradesh and can able to contribute also into the development of part.
Thank you.
So what is your suggestion, ultimately?
So, suggestion is that at the state, one of the learning for us was that there is a lot of, as sir was also saying, we have a lot of data, but where is this data all going to? Is this data actually used to drive the programs for better? I think if we can able to at all level able to create the right information to the right person at right time to drive the right decision, we can able to solve this at a better way. And in the state, if we can have this command and control center which can have a surveillance of the facilities.
What is your expertise? What is the product you are having on that?
So at every level, we can able to help in the creating governance mechanism and deploy the digital solutions. And with the youth, we have almost like 600 fellows working with us in which are between the age group of 20 to 26. They are the one who is doing the change management on the ground.
Right.
And these are the people who actually passed out from the IITs and good colleges of India, 100 top colleges of India. They actually go and stay in the villages, work with the community, support the system in establishing the change management and deployment and adoption of the programs.
So Rohit, if I may help you reframe, sir, I think the work they have done in UP and Bihar is they built multi-level dashboards using government data, and they also mobilize the youth to verify the data, and multi-level governance has become possible, and that's a solution they are willing to offer to other people.
What I am thinking, we are also working everything systematically,
Right.
all departments, and also I told you, as on today, governments are using data standalone systems.
Correct.
Because of that, we are having a problem of comparison, all these things. Now I am bringing uniformity. If he is having any ideas how to integrate, we will be very happy to associate with him.
Sure.
Sure, sir.
Even not only Andhra Pradesh, even I am integrating with the government of India, Ayushman Bharat, APAR, all these things.
Right.
That data also I am integrating. So that single source of truth, so that decision making will be very easy.
Right.
Or otherwise, multiple channels again will have a problem.
Absolutely.
If he is having good ideas, we will sit with you. Even we are using all knowledge available for overall improvement of the society, either health, agriculture, all departments of the matter.
Sure. Thank you, sir. And like Krishna Babu Garu is already doing, he is integrating multiple department data for health.
Thank you, sir.
Yeah, we will do that. I am telling you, government approach, very clear. As on today, historical information we are having, some of the departments, but stand alone. Pensions, one format, one department. Health is different, or ration is different. Like there are so many departments, so many ways we are using.
Right.
Now I am bringing one citizen, all services, one family. This is the concept we are working. Historical data we are having, dynamic data we are collecting through Ayushman Bharat. Every day somebody is going to doctor, he will treat, he will update data. That type of data. Second, through IoT's data or CCTV camera data, or tomorrow drones I am sending that data, every data. By using all these things, then I want to go artificial intelligence and also predictive analytics, finally ML, AL, anything for a matter, then deep technology.
Right.
Ultimately, I want to provide best solution for the problem without confusing anybody. That is where nowhere in the country as on today, governments have done. First time I am approaching integrating with all the data. Truth is one. The truth, how to bring it, individual, family, on various problems. It may be health, education, skill, agriculture, anything for that matter. All layers we are building.
Right.
There, if you can come any ideas, we will be very happy to associate with you.
Thank you, sir. Thank you very much, sir. With your permission, somebody has traveled a long way to meet you, son of the soil. Principal Secretary from Meghalaya, Mr. Sampath Kumar is here. I would like to invite him to come on board and share with us his thoughts. He's put a lot of thought about Andhra, what needs to be done.
They are doing some work.
Thank you, sir. So, sir, first of all, I would like to thank you, sir. In fact, you provide a very inspiring and exemplary leadership for the whole country. In fact, so one thing, sir, I would like to tell about a use case. You asked about use cases. Sir, Meghalaya is a small state, but a very difficult state, sir. So, for last over 5 years, we have been working on one model, sir, based on what you said, population management. Sir, maybe I just like, there is a, if you look at, sir, in India, average below 18 years, about 35% of the population, sir. Meghalaya, we have about 49%. So basically what you just said, sir, we have a demographic dividend, but are we actually unleashing that potential of the demographic dividend? So when we look at the indicators, sir, like if you look at, sir, we have 35% stunted population. Stunted population means their brain cognitive capacity is not fully developed. Similarly, we have, look at the data, like class 5 students cannot actually apply the numbers. Class 5 students cannot simply comprehend. So there are almost like 45 to 55% students are not able to achieve that learning outcome. So investing on people is a great idea, sir, what you are saying. So what we did, sir, we created a human development pyramid based on the brain science. So brain science says, sir, in first 5 years, actually we in fact 90% of the brain develops. So in fact, if you see one Harvard Center for Developing Child, the graph, I think maybe you can show it late, next slide. So what happens, sir? I would like, maybe you can see, this is the kind of a thing, sir, maybe just a slide that we have shown. So this one, sir, the brain capacity, the neuroplasticity we call it, it's very high during the first early childhood development period. And the second opportunity is adolescent development period. So if we invest in during these two periods, we get actually phenomenal results. There is a study done in US, the Perry School project, which shows that, in fact, the Nobel Prize winner, he had proven that for every dollar we invest, we get almost like 17 times return on investment. So investing to do that one, sir, what we did, we formed a human development council headed by the chief minister, sir, and then integrated all the departments and prioritized all our actions towards unleashing that potential. So even training the parents how to do positive parenting, how not to do altercations or anything before the children, so that it will affect their brain. So such kind of a very intensive exercise we are doing. Sir, actually we have set up a government innovation lab in Meghalaya. In fact, our Honorable Chief Minister also, like you, sir, he is also very innovative Chief Minister. We all wanted to come and sign a MOU with the government of AP, and in fact bring a lot of these ideas. Sir, in fact, we are learning from the state of AP. We have taken our CRPs from here to Meghalaya, who are teaching us natural farming. So what you said, sir, knowledge economy or knowledge, you wanted to make it. I think the sharing of the knowledge and sir, the ideas would be very helpful. We would like to, in fact, put forward this idea before you. But thank you, sir, for all your inspiration.
No, what is your when you started this project? How much time? What is the outcome?
Sir, actually we started this entire idea. We started during the COVID, sir. COVID gave us a lot of opportunity for us to really deeply think. So the outcomes, sir, actually would like to show this. Actually, sir, this is a project, but I would like to show there is a 50% reduction in the maternal mortality rate, sir, in the state, which is the sharpest decline anywhere in the world. In fact, which has been, sir, actually now Harvard University is actually taking it as one of the cases to teach as part of their courses. So that's the kind of a result, sir. So basically, in fact, ADB, I think Dr. Dinesh Arora spoke to you, World Bank, they're all working with us, sir, basically investing at different life stages. Maybe investing on people like Gurujada Apparagar Chepinat, sir, like maybe like Desamante Mattikadu, Desamante Manishiloi. I think, sir, the way you just mentioned population management is so important. Otherwise, the replacement rate is coming down. Definitely, sir, I think we need to unleash that complete demographic dividends. Thank you.
One is the demographic advantage. You are able to do population management also simultaneously?
Yes, sir. Sir, because, sir, to unleash that early childhood development period, one has to give a lot of time, sir, actually. So basically on children, so parents, schools, Anganwadi workers, self-help groups, everyone has to give time.
No, I can understand. I am asking straight question. One is, that is a very good thing, awareness building, everything you have done, council, all these things, structure. But what is the population replacement level in your state?
Sir, ours is actually, sir, we are actually, in fact, number 2 in the country, sir. 2.9 is our total fertility rate.
2.9?
We actually will going to be the number 1 in NFHS 6, sir. So we are basically, we don't actually, sir, we actually only say spacing. We don't, because we don't actually talk about, in fact, we spacing so that there is a better maternal health, as in fact, one of the speaker was mentioning, sir, actually how to really teach those things, to entire.
You give all the details.
Yes, sir.
What is your success story?
Yes.
We are having some success stories. We will work together.
Okay, sir.
Meghalaya government and Andhra Pradesh government can work together.
Thank
I will be very happy.
Thank you so much.
Thank
Thank
you.
you.
Thank you.
Sir, if I remember right, I think in your time, water mission you set up so long back. You brought together 17 departments. I think the idea is very similar, sir. Setting up a human development, this thing, and having that focus. That's about it.
That is a good concept. We will work it out.
Sure.
Sir, I want to say something in relation to health, because I've been hearing so many. About 14 years back, we started health centers in addition to our business in memory of my parents. So we started in all small districts like Srikakulam, Narsipatnam, Gajuwaka, Bhimili, and my village, opposite NTR's village, Nimakuru. So we are now able to serve every single day 1,800 to 2,000 poor patients, and in a month 50,000, annually 500,000 people. And this is happening for the past 15 years. What do? We have all diagnostic tests, including X-rays, blood tests, ultrasound. There are about 70 doctors working in all these 10 centers, and they are paid less, retired people, ESI, government doctors. Directly we are able to feed into the mouth of each patient. And Jeevandhara Pharmacy giving medicines at 80% discount, cost, charging them 20%. So just to give you an example,
can we come to the
consultation fee of a doctor is 20 rupees.
Sir, suggestion please, straight, if you don't mind.
Sorry?
If you can come to the suggestion, what you have.
Yeah, suggestion. So the solid work is going on, actual solid work at the ground level. I would urge you to depute somebody, look at our Varun medical centers, not anything hi-fi, but the solid work is going on. Lots of poor people are being helped. And a lot of people who are sitting here, they all know about it because they have been sending their drivers. And the second thing is, we are running skill development centers, 8 of them. So about 1,000 boys and girls are prepared for denting, painting, air conditioning. So when we have one side unemployment, the other side, there are people are not available with skills. So from that direction, because we employ a lot of people, so we are preparing 1,000 boys and girls. So why don't you have somebody visit our skill development centers and medical centers? People like us, there are so many entrepreneurs. Each district, if you can ask 4 of us to start 5 or 10, your basic problem is solved. You can capture all these typhoids, blood problems at the beginning before they accelerate to a bigger disease.
Thank you.
We are actually doing groundwork.
Thank you.
We'll work it out. We'll ask our people
Know
to.
about it, but I
You
just...
get all the details. We'll encourage others. In skill development also, we'll send our team to study.
Yes, ma'am.
Congratulations to Great Dias. It's not just to
Mike Dagarbet.
sustainable transformation Dias, but it's a Dias to extract the intellectual wisdom and wealth from the next generation. And I'm requesting the Great Dias to create virtual and physical governance, research and development, holistic research and development template. Unless we create a just major template, the template, like with reference to deep tech, like the AI template, with that the AI template, we can connect sub-AI levels. At the same time, before going to all these dynamic structures and template of the governance, which is connected to virtual and physical Dias of the governance, we need to work especially on environment. And always you're telling, sir, I'm a student of you from the beginning. Since my student days as union representative, I know that. So I interacted you. From the beginning, you're also very concerned to environment. So nowadays, in India, what I experienced, I can't walk even a kilometer or half a kilometer on the roads. because we are not only in just urgency of the work referring to environment, but it's emergency. Unless we work towards environment maintenance and cleaning and just management, we can through, if you initiate, so your dais is not a just political dais, it's not a governance dais, it's a service dais. And your forum with intellectual forum, concerned about the government of the people of India through P4 policies, so we can work first through environment issues. So eco-friendly approaches, and you can collaborate. You are the right persons with the help of our national leader, Prime Minister Modi, and you, the great dais, can collaborate, can initiate, can take all the people, irrespective of any discrimination, industry, people, public, private, all the stakeholders. So
Madam,
can do wonders. For this, I have a strategy. So I'm requesting you, sir, to initiate environmental program through great dais.
Thank you.
Thank you, sir.
Thank you so much.
With definitive, we are working in a big way. Swachha Bharat is one. Government of India has created a department itself. Overall comprehensive idea of Swachha Bharat, we are having Swachha Andhra Pradesh. We will take up this issue as a campaign mode. For the last 5 years, if you see in Andhra Pradesh, even garbage is totally, they are unable to lift also. Legacy garbage, nearly 85 lakh metric tons are available in Andhra Pradesh. That is a big challenge for us. Long back we started from waste to energy, waste to compost, everything. Again, we will work on environment front, how to improve greenery, forests, how to make it clean, everything. All people has to join together. Ultimately, we have to create a legacy on environment. We have to tell proudly, this is what we have achieved. There is a contribution from every individual regarding environment protection, then only it will happen. We will work it out, we will come back with clear-cut milestones and involvement of every citizen in the state. We will do it.
Thank you, sir. So this is the last question. Last question, please. I know there are a lot of people queuing up for questions. Real apologies. CM sir's time is very less, and this will be the last question, please.
Good evening, sir. Thank you very much for this wonderful program. I wanted all of the members to know, I was interacting with 2 startups in the morning, sir. So how we can take them forward. One was RapidX. I would request, the suggestion would be to make them involved in all the blood banks. What they are doing, sir, if you take a blood sample, when you take blood out, we only test for hemoglobin. 90% of the women are hemoglobin deficient, sir. But this instrument is telling which type of anemia. They're also testing for malaria, and the beauty is they're testing for cancer screening also, sir. And they're not charging, it's only a monthly charge of 5,000. So if we make it, that startup's name is RapidX, they have deployed, yesterday I spoke to them. If we can mandatory for all the blood banks to have that equipment, the advantage would be, sir, everybody donating blood would be screened for blood cancer also, would be screened for malaria also, and for which type of anemia also. All those things are not happening now. So that we will be the first state in the country where a donor will have access to all these facilities free of cost. That is one suggestion, sir. There's another startup from Nipun Sahani, son of Mr. Ajay Sahani. They were testing for viral infections, and their test was costing only 100 rupees compared to a 2,000 or 3,000 rupees, which took 7 days. They're testing in 10 minutes, and they're requested for doing it in KGH. So if we could facilitate these things, I think the outcome of this conference will be directly available to the public. They will really see for themselves how many people are benefiting this great initiative. The last suggestion I have, sir, you were talking about the data available with all the government institutes, government hospitals. Data is gold nowadays, sir. If we can randomize the data and people who are doing research in AI can actually access this data, if there is a platform where they don't need to run anywhere, it is clearly available that they can access this randomized data without the name of the person. That will fetch a lot of revenue. We can monetize this data to earn gold, sir. So there should be, the suggestion is to create a mechanism where randomized data of all the patients is available for research companies where the government can earn money. And the last suggestion, sir, one last suggestion, sir. The previous government had 17 medical colleges, sir, and you see that infrastructure also is not built. All the medical colleges in Andhra Pradesh, sir, the entire infrastructure is free after 5 p.m., sir. So my request is, instead of starting a new medical college, if we can just appoint new faculty in the evening, we can have double the medical college in every medical college in Andhra Pradesh.
Thank you.
That's the only suggestion I have. Thank you very much, sir.
ఓకే మా వెల్ టేకన్. మీరు చెప్పినట్టు అన్నీ కూడా ఆల్రెడీ స్టార్ట్ చేశాం. ఈరోజు మార్నింగ్ వాళ్ళు ఇచ్చిన చూశాను నేను, సహాని వాళ్ళు కూడా తయారు చేసింది. ఆల్ యూస్ కేసెస్ విచ్ ఆర్ యూస్ఫుల్ విల్ లాంచ్ ఇమీడియట్లీ. దెన్ విల్ సీ ది రిజల్ట్స్. ఐఎమ్ అష్యూరింగ్ యూ వెరీ సూన్ వీఆర్ గోయింగ్ టు క్రియేట్ ఎ బాడీ ఆల్సో, వన్ కమిటీ టు సెలెక్ట్ ఆల్ దీస్ థింగ్స్. Across the department, single agency will do all these things. That is one. Second one, as you rightly mentioned, all the data, not only monetization for the government. I want to go for startup companies to use this data and create use cases. Again, they can come back, we will use that. Then proof of concept is right with accuracy. We will certify them. Then they can scale it up commercially.
Right.
That also will encourage. This is where from the morning I am hearing all of you. Detailed way we are going to check out a program. Already we are having clarity. We will improve further. We will put it for public consumption and public utility. Basing on that, once in 3 months, we'll have similar sessions, computation, everything. We'll review continuously till we reach reasonable level.
Right.
That is what I am thinking. We'll work it out.
Thank you, sir.
Anything?
Sir, there are a lot of people waiting, sir, but time is less.
What is that youngster? What is your suggestion? Carry on. Come.
Good evening, sir. Actually, most of the delegates who are most senior leaders and innovators, they got the chance to question. I am a third-year student. As a young entrepreneur, I just have a question. Mine is an AI-based startup in software as a service and product. We are making augmented reality smart glasses for blind, deaf, and mute, sir. And after seeing your in your assembly where you have spoken, you have shown your ring. So I thought of to get a chance to demonstrate myself here. So I've past 8 months I have been trying in 3 governments, that is Madhya Pradesh, Gujarat and Telangana government, to incubate my own startup, which is not being possible. So with this smart glasses, with the wearable ecosystem, which is being available at low cost, our goal is to give a facility which is being given to the richest person. Same facilities need to be given to the poor. So we are delivering it in a low cost. So
What is the product?
Augmented reality smart glasses for blind, deaf and mute people. So how the Andhra Pradesh government can assist me in incubating my own startup here?
Okay, you be in touch with him. We will work it out, but we will structure it. People like you how to go about. That is where I told you tomorrow there will be incubation hub in Visakhapatnam itself. You can go straightly. Then they will handhold, they will guide you, they will mentor you, they will launch you, and then they will take to the logical conclusion.
Thank you so much.
We'll work it out.
Sir, one very last question from my side. In your first term in the undivided Andhra Pradesh, you were worried about malarial deaths and you started reviewing the program very hard. And at that time, around 10,000 deaths were there roughly. And it started going down very, very rapidly once you started reviewing the program. But then we also saw data which showed deaths due to unknown reasons going up very strongly. It could well be that they were classifying it as unknown because CM Garu is reviewing it. So one last question to you is that are you worried with the way data, tech and AI trends? Which are the worries for you, which is keeping you up in the night? Just the last question, sir.
Follow your question. Can you repeat?
Are you worried about how the data and tech can also be manipulated, can also become a problem rather than only a solution?
No, from the beginning I am telling you very clearly. In computer you feed garbage. Garbage only will come out as outcome. I'm very clear on that. So, data scrutiny, corrections, updation, it should be 100% foolproof, then only we will get 100% perfect information. For that, checks and cross-checks, everything we have to follow. Even recently, one example I'm giving you, how computers are very dangerous. Land records. Government has wanted to, they are saying we are computerizing your records. Then there is a clause 22A. Once if you add 22A, it is government land. If you delete 22A, it is private land.
Right.
Then what they have done cleverly, they added 22A. Manipulation. Then people will be, automatically that middleman or broker will come, your land you give it to me. If you won't give it to me, then it is 22A, it is government land. Then you face the music. Then that fellow, poor fellow, where he will go? Naturally he is surrendered. Some people have compromised, throwaway price they have given. Again one word, 22A, they deleted. Then automatically land is valid, private land. That type of manipulations is very danger in computerization. That is where Government of India, Aadhaar is 100% foolproof. Our digital currency is working very well. 40% transactions globally we are doing. Still, cyber security is a threat.
Sure. Thank you.
I have given digital currency report. At that time, I used to call everybody, Reserve Bank, bankers, even service providers, even technology persons, everybody. I used to ask them only one question. What is the security? Is it 100% foolproof? Nobody told me it is 100% foolproof. Always technology, some fraudulent fellow is more efficient than you, is more innovator, then you will break your
System.
program.
Yeah.
That is the biggest danger. But at the same time, governments, regulatory agencies has to be very clear. We have to control. Data, I am assuring you, what we are going to get 100% foolproof data, nobody can tamper. And also, on the base of that, I want to take decisions. And checks and balances, passwords, everything, what are all the security we can keep, everything we will keep.
Wonderful. Sir.
You can rely on government data in course of time. We will purify everything, every data, single source of truth. This record is there, it is 100% foolproof, that is our sovereign guarantee. I am telling you, I am assuring you that stage we are going to reach very soon.
Thank you, sir. Thank you very much. CM Garu has spent almost an hour listening. I know some of you are waiting for questions. Our sincere apologies. We will now go into for MOU signing, and then the rest of the speakers will come later after that. So those of you who had questions further, our sincere apologies. We are not able to cover all of them. Sir, thank you very much. A big round of applause to CM Garu for his time.
Now, one question I want to ask all of you, because you are all intellectuals and also technical people, some people are interested in technology, all these things. This type of conferences are useful in course of time. If it is useful, can you raise your hand? Okay, that's good. Yeah, I will make it department-wise and also integrate technologies, everything use cases. Ultimately, data where you are going to get, that is one issue. Either drone or CCTV camera or otherwise your cell phone or your satellite or sensors. That is your innovation. Ultimately, I need use cases in government and public use cases. We will promote all these things. Department-wise, we will have some special sessions where you can exchange with them and then you can provide some services to them. We will work it out. No, that is again, it is a legacy problem. We are overcoming all legacy. Even I am working one more thing. Tomorrow for all incentives, I want to start escrow account. Immediately, whenever you complete the work, it will come automatically. Nobody can change in future. I am thinking that also, escrow account. I will open. Biotech hub we will keep. Long back I have started that Genome Valley, Hyderabad. Again I am thinking seriously here biotechnology. Yeah, we'll make it. One of them, either Anantapur or Uttarandhra will make it.
Thank you, CM sir. Now quickly, I request Honorable CM sir and CS sir to be on the dais. I request Sanjay Gupta ji, our CEO, to be present on the dais. We have 7 MOUs between GFST and different organizations and also with Government of AP. I request all the concerned people to be readily available so that we can finish them quick succession. The first MOU is between GFST and Samagra. I request Mr. Gaurav Goyal, CEO and MD of Samagra, to come onto the dais, please. So these MOUs are basically for project monitoring, institutional support and studies. Now next MOUs are between GFST and GAME, Mr. Ketul Acharya, President, and Mr. Mekin Maheshwari, Founder. I request both of them to be quickly come onto the dais, please. Then next MOU is GFST and German University. Mr. Raz, please. Mr. Raz from German University. Yes. नाम पढ़ने के बाद दे दो. नाम पढ़ने के बाद दे दो. Next. Doing it, sir. He is talking. German. GOIP అని ఒకసారి చదువుతాను. నా కంఫర్ట్లో నేను చదువుతున్నాను సార్. గేమ్ అయిపోయింది. గేమ్ సరే. GSR, Fluent Great, GOIP is there. Be there interactive. So with German University, request Mr. Raj to be on the dais quickly, please. The next MOU will be with between GFST and Fluent Grid. Dr. Murali, please. Next MOU between GFST and GSR, Dr. Srinivas Kosala. between Government of AP, one is with CMS. I request Mr. Swakati Karuna, IAS Commissioner, Health and Family, and from CMS, Mr. Shivkumar, Founder. Anyone from AIG Hospitals, please? I request the entire GFST team and event management team to quickly come for a picture with the Honorable Chief Minister. Request all the GFST team. Ramnath Garu, Samsara Garu, Raju, Adil, please quickly come.
You gotta put your past behind you. Look, kid, bad things happen, and you can't do anything about it, right? Wrong. When the world turns its back on you, you turn your back on them.